So the posterior or dorsal body cavities, we're going to look at. So you have the cranial cavity and the vertebrae cavity. So remember, dorsal means back, and so does posterior. That vertebrae cavity is going to be enclose that spinal cord, and that cranial cavity is going to enclose the brain. Anterior, the ventral body cavities, we're going to have the thoracic cavity and the abdominal cavity. So, thoracic here is going to have that pleural cavity, pericardial cavity, and the mediastinum cavity. Then we have the abdominal cavity and then the pelvic cavity. So, you might have to pause this so you can write it in your notes. Hopefully, you can fill these in: cranial, posterior, vertebrae, thoracic, diaphragm, abdominal, and pelvic. The body is also broken into quadrants. So the landmark for this is used as the belly button. And from there, we're looking at anatomical position. Remember, so this would be our patient's left side and right side. So the doctors can push on certain sides, and they know that in the left upper quadrant is going to be that one side of the liver, the adrenal glands, stomach, pancreas, spleen. So doctors know while pushing on this, if you have left upper quadrant pain, that maybe it could be your pancreas or your spleen or something like that. So this kind of just helps them know what is in what side of the body. And then lastly, the body's also broken into regions. Kind of crazy that once again it's even broken down further, using that umbilical region kind of in the middle as well, and kind of going so doctors even further know the regions once they're in those quadrants.